parents, what should they be telling their kids, so that there is not that isolation? I mean, you've talked about Eric feeling that he was isolated, and what should parents say to their children?
I think the most important thing to teach our children is the same thing we've been doing for many, many years in public education and in private sector, is that people are different.
Right.
People are different. Children are different, and just because they look different or they act different doesn't mean that they're not special, doesn't mean that they're not people you can be friends with or relate with. Eric is a very normal child. He is a great kid, and he's got a lot of spirit, and I think that if they got to know him, they themselves might learn something about the uniqueness of human nature. I mean, these children, Nicky once was approached by a little boy. He was little. Obviously, he passed before he was 5, so he was little, and when he was going through chemotherapy, a little boy said to him, "Why don't you have hair?" And Nicky, being who he was, he just very normally responded, "Well, why do you have hair?" Didn't know any different.
Right. Being different doesn't make it wrong.
Right, correct. And you learn a lot from these children, and I think that other kids and teenagers Eric's age could learn from Eric on what it's like to go through something so devastating. And those children may have family members that are adults that have gone through this. Yes. So from a kid's perspective, he may be able to counsel them in some areas as well and lend something that they wouldn't have gotten anywhere else.
Right. With the Ride for Eric, when you talk about support, we've talked about emotional support, and I remember Norma sharing with me, things like families, the financial impact on a family when you're going through this. And we're not necessarily talking about people have health insurance and things that are covered, but what are some of the other financial things that that people absolutely would not even think about?
So much more. While you're away, it's all your meals, your gas, your parking.
Hotel. I remember I never thought about the fact of hotel rooms, staying in a hotel that's near the hospital.
The hospitals give a lot. They send social workers, and they have a team of psychologists, and they work with your emotions. They work with you financially. They know parents' financial needs. One of the things that we had experienced at Sloan Kettering, where we had sent our son, it's New York. It's 2 hours away. And I drove because on any given day, you don't know when your appointments are going to be really follow through with the schedule they give you for the day. Your MRI could be scheduled for 10 and it doesn't happen until noon, and then you're there longer. So we always drove. We didn't take the train, which would also be another cost that people have. Parking alone. If Nicky went in for a surgery, which he had many of, 12 of them to be exact, we went in for a surgery. We were there for 7 days. I had $500-600 parking bills that we had to, and other families had to pay. And there was very little the hospital could do with that type of situation. They could give you gas cards. They gave you meal cards. They took care of your meals. We were very fortunate that we only needed to stay at the Ronald McDonald House once or twice because I had a great deal of family support. I always spent the night with him. His father would come and go and take care of our other son, which is also important. A whole nother issue. Jason, too, I'm sure Norma would take care of Eric while Eric was taking care of their other son. So there's those types of things that they add up. $500-600 parking bill before you know it. And then if there's a doctor that's a specialist in the area but he's not covered by insurance, then you have the additional 20% in some cases where you have to pay. Brain surgery is very expensive in our circumstances. I mean, I put out a lot of money as well. So the support financial, and that's where Norma and Ride for Eric also comes in, which is a very big thing where we can give to families that need gas cards. They need a couple extra $100 to stay wherever they need to be. I mean, when you're going through this, you're not thinking money. You're thinking survival.
Of course not. Right.
Survival.
And one of the things that impressed me when I met with Norma really originally was that this is a local, grassroots, charitable effort. It is. I mean, there are very big organizations, American Cancer Society, and who fundraise obviously on their own, and other kinds of organizations. But I really was touched by this grassroots effort to provide this for local families, people that are right here in Hunterdon County and right in our own community.
And there's more than you would realize, more children.
Many.
Because I'm finding more and more that need help.
And I think that that's so important that that you ladies and the folks that you're involved with are empowering your own organization to try to reach out again. This is a local, initiative.
The community has become our family.
It's
and
true.
we want them to know that we're here to support them, because I know that, and I will speak for Norma for a brief moment, just like I have experienced, they were there for us. Our communities have reached out to both of our families and have been very supportive, and this is our way to give back, to raise awareness, and to be helpful in their journey, because it's not easy. It's far from easy.
Norma and Stephanie, in the community, if I was a family or a parent that was going through the same kind of thing, how would I know about you, or how would you know about me?
Okay, we have a website that that anyone can go to, and all the information is on there. And just send an email, and we'll get you help.
And do the local physicians know about your organization? I mean, if I'm like going through this, would they?
I've been trying to contact all the area doctors and for their support, and our doctor, Dr. Bernard, has been very supportive of this. It just takes a lot of hours trying to put this out here, trying to get the word out to people, and every year I hope to grow more and more to put more awareness out.
And hopefully people watching too, these kinds of venues are important, because people can say, I saw a show on that. I saw a show on that.
Exactly. Well, September is Childhood Cancer Awareness Month, so.
It's such a frightening, devastatingly frightening topic for any parent, that your first reaction to it is, well, that doesn't have anything to do with me, so I don't have,
But it can.
But it can.
But it can.
But it can.
And you may know someone that you can help with. I mean, we have found through this that, like I had said earlier, Norma has, I know there's somebody you can talk to. So whether it be the monetary or the emotional, it's important that we come together and we fight this together, whether it be the emotional or the monetary and the research. That's incredibly devastating what cancer has done to us as the human nature, the human society, that we need to be there for each other and be supportive. I find it incredibly enlightening to be a part of Norma and her family, and to be there and to allow Eric to celebrate his life, and yet to also give.
Yeah, and I think that with so many diseases, the research piece is huge, and the dollars, fluctuate in cancer research, from one year to the next, and from one type of illness to the next. And there's been, a lot of, there's so many places where we've made a lot of strides.
Yes.
And there are so many frontiers that we still have not, we just have not conquered or made progress. And it's incredibly frustrating, I think, when you're affected by one of the things that is, we're just not there yet. We're just not making that kind of progress. Well, I want to thank both of you for, this was very brave and incredibly difficult, even for me, to talk about something that is so incredibly emotional, and of course having two very different versions or endings to these stories, and yet the fact that both of you together have joined forces to do something positive for others is often the only real way to give back. And so I wish you lots of success with Ride for Eric as the years move forward, and hope that people watching understand that we have a local organization and we have a local grassroots opportunity for people to get emotional and other kinds of assistance that they need. And so I want to thank both of you for being here with me today. And for more information on Ride for Eric, you can refer to the website at the bottom of the screen. And I hope that this was as informative for you as it was for us. And I want to thank you for joining us today. I'm Lisa Brady. I'm the superintendent for Hunterdon Central. And this was Eye on Hunterdon.
you.